Now, 1 in 5 Australians will experience a mental illness. Mental Health First Aid Australia is running training courses on suicide prevention. And joining me from Melbourne is Nataly, Bovopoulos, CEO of Mental Health First Aid Australia. Nataly, thank you so much for taking the time to speak to us. This is a popular course, and there are similar courses right across various states across Australia. Just explain to us, why is there so much interest in mental health?
Well, as you rightly said, mental health problems in Australia are really common. So 1 in 5 Australian adults will experience a mental illness in any given year, and about 3,000 people per year will take their lives by suicide. So most people have been touched by a mental health problem or by suicide in one way or another. And I think that people want to know what to do, but are not very confident, not very clear about how to help, and that often prevents them from helping. So
talk to us about the course. What's involved in this course? How do you actually spot the signals?
So what Mental Health First Aid teaches is how to assist someone developing a mental health problem, experiencing a worsening of an existing mental health problem, or experiencing a crisis by applying an action plan. So just like in first aid training, you learn an action plan to apply to different various illnesses or injuries. People learn how to apply this action plan in a safe environment so that they feel confident by the end of the training to actually ask the question and follow through and encourage people to seek professional help.
For those of us who may be watching and who may know someone who may be going through a bad time, what are the signs that they should be watching out for?
Well, I guess the big thing is about change from normal behaviour. So, and over a period of time, over a couple of weeks, and it might be in the way that they're behaving, it might be in the way that they're appearing, or it might be in the things that they're saying. But there are things that you can notice once you're trained to recognise the signs.
And in terms of the course, do you provide how to counsel someone who may be going through a dark time?
So just like first aid doesn't teach people how to become a surgeon or a doctor, mental health first aid doesn't teach a person how to become a psychologist, because that's a very important profession that takes years to learn how to practice. But what people learn is basic skills and how to open up a conversation about someone that they're worried about, and ask direct questions about how they're travelling, and to encourage them to seek professional help. First and foremost, usually their GP.
Nataly, those who are suicidal usually find themselves in a very dark place. They're unable to see things clearly. What would make someone in that state change their minds?
Well, I think that people who are feeling suicidal are in pain, but are not enjoying that pain. And if people ask them directly if they're feeling suicidal, then they'll feel less alone and feel like that there are people out there that are willing to help and willing to listen about what they're going through and support them in receiving the appropriate support that they need. So I think first and foremost, it's about actually asking that question and demonstrating that you're willing to hear the answer.
Nataly Bovopoulos, thank you so much for speaking with us.
No problem.
And if you need information or support, you can always contact Beyond Blue on 1300 22 46 36. Or if you or someone you know is experiencing distress, please contact Lifeline on 13 11 14.